Hi there, this is Dr. John Whitcomb talking about how vitamin D increases vascular health. This week, a study was released in the Indian Journal of Endocrine and Metabolism that looked at 103 patients with low vitamin D, less than 20 nanograms, who were given a good dose of vitamin D. They were given 60,000 units a week for 8 weeks, and vascular function was measured. What they found was that pulse velocity, which is a measure of the stretchiness of your arteries, you don't want rapid pulse velocity, you want nice stretchy arteries, decreased about 10%. And blood pressure decreased from an average of 115 systolic to 106. And other measures of vascular health improved oxidative status. Now this confirms prior studies that have shown that last year a study came out in the American Journal of Cardiology showing a statistically significant improvement in ejection fraction in patients with congestive heart failure. But I've been looking for an article showing just how that mechanism was. And so here's that mechanism. And we've reported on previous studies with infants who showed dramatic increase when their vitamin D level was 0. But here we have an explicit study looking at that. What are my comments? We have a lot of negative studies on vitamin D, and my belief most of them stem from the fact that we give completely inadequate doses of vitamin D for completely short periods of time. What you'll see, the literature supports it, and my experience supports it, that many folks take a year to get to a new homeostasis when you start on a new dose. So many studies that run for 12 weeks, their clients in their study are never have gotten to an adequate dose. So giving 600, 800, 1,000 units, you'll never get to adequate dose. And I consider an adequate dose a blood level of 50, because that's what human beings get when they have natural abundant sunshine. And that's what many hominids get to in the wild when they have natural abundant sunshine. So I think we now have a study showing that vitamin D clearly participates in helping congestive heart failure. And that means you should be on it, I should be on it, we should all be on it. As we get older, congestive heart failure kills almost half of us. So it needs to be added to all of our routine regimen. It's a guidepost for you to follow. So what will work for me? I measure my vitamin D level about once a year. I'm usually around 50. I take 100,000 units once a month. And that's the equivalent of 25,000 a week or 4,000 or 5,000 a day. But I'm a tall person. An average person probably needs 20,000 units a week. That's probably what you should be on, but check your blood level. This is Dr. Whitcomb wishing you no congestive heart failure. Thanks.